Good day, students. So for today's discussion, we will continue to discuss Lesson 5 of our Economic Impact on Communities in our fourth quarter module. Economic impact on communities. In our modern societies, opportunities and rewards are still unequally distributed across different social groups. For example, between women and men, people from different families of origins, between migrants and nationals. So our research on socio-economic inequalities will focus on the development and perpetuation of inequalities during individuals' life course and the role of contextual factors. So in addition to this, in particular, it will analyze the individual, family, and institutional factors which shape and drive a variety of inequalities that emerge during the early and middle years of childhood across a range of outcomes. So including cognitive development, school achievement and engagement, well-being, and pro-social behavior. So a multi-dimensional approach will be used to analyze the effect of children's family background, disentangling the influence of parental education, social class, household income, family structure, and ethnicity on children's outcomes, as well as recognizing the potential of intersectionality. So that leads to the economic impact on communities. So in 2019, the Philippines was one of the fastest growing economies in the world. It finally shed its sick man of Asia reputation obtained during the economic collapse towards the end of the Ferdinand Marcos regime in the mid-1980s. So after decades of painstaking reform, not to mention paying back debts incurred under the dictatorship of Ferdinand Marcos, the country's economic renaissance took root in the decade prior to the pandemic. So posting over 6% average annual growth between year 2010 and 2019 computed from the Philippine Statistics Authority data on GDP growth rates at constant 2018 prices. So the Philippines was touted as the next Asian tiger economy at that time. Economic impact on communities prior to COVID-19. So the rude awakening from the pandemic was that services and remittances lead growth model doesn't do too well in a global disease outbreak. The Philippines' economic growth faltered in 2020, entering negative territory for the first time since 1999, and the country experienced one of the deepest contractions in the Association of Southeast Asian Nations that year. This shows in our figure 1. So, and while the government forecasts a slight rebound in 2021, as you can see in our figure, some analysts are concerned over an uncertain and weak recovery due to the country's protracted lockdown and inability to shift to a more efficient containment strategy. So the Philippines has relied instead on draconian mobility restrictions across large sections of the countries and key cities and growth hubs every time the COVID-19 surge threatens to overwhelm the country's health system. So what went wrong? How does one of the fastest growing economies in Asia falter? It would be too simplistic to blame this all on the pandemic So first, the Philippines economic model itself appears more vulnerable to disease outbreak. It is built around the mobility of people, yet terrorism, services, and remittances feed growth are all vulnerable to pandemic-induced lockdowns, and consumer confidence decline. International travel beyond tourism came to grinding halt, and domestic lockdowns and mobility restrictions crippled the retail sector, restaurant, and hospitality industry. Fortunately, the country's business process outsourcing BPO sector is demonstrating some resilience, yet its main market have been hit heavily by the pandemic, forcing the sector to rapidly upscale and adjust to emerging opportunities under the new normal. So second, the pandemic handling was also problematic in this kind of situation. Lockdown is useful if it buys the country time to strengthen health systems and test trace treat systems. So these are the building blocks of more efficient containment of the disease. So however, if a country fails to strengthen the system, then it requires the time that lockdown affords it. This seems to be the case for the Philippines, which made global headlines for implementing one of the world's longest lockdowns during the pandemic, yet failed to flatten its COVID-19 curve. So at the time of writing, the Philippines is again headed for another hard lockdown, as you can see in our images, and it is still trying to graduate to a more efficient containment strategy amidst rising concerns over the Delta variant, which has spread across Southeast Asia. It seems stuck with on over again and again off and again lockdowns, which are severely damaging to the economy and will likely to create a negative expectation for future COVID-19 surge, as you can see in our second figure. So the second figure clarifies how the Philippines government resorted to stricter lockdowns to temper a surge in COVID-19 in the country so far. The figure 2, community quarantine regimes during the COVID-19 pandemic, and the Philippine National Capital Region on March 2020 to June 2021. So note from most severe mobility restrictions to less severe, the regimes are enhanced community quarantine or the ECQ, similar to ECQ but with slightly fewer restrictions. The modified enhanced community quarantine, the MECQ, and similar to MECQ but with slightly fewer restrictions is the GCQ. The similar to GCQ but with a slightly heightened restrictions, the general community quarantine, the GCQ. So if the Delta variant and other possible variants are near-term threats, then the lack of efficient containment can be expected to force the country back to the draconian mobility restrictions as a last resort. Meanwhile, only 2 months of social transfers, or the ayuda, were provided by the central government during the 16th months of lockdown by mid-2021. All this puts a more pressure on an already weary population from deep recession, job displacement, and long-term risk on human development. social transfers, support in the midst of joblessness and rising hunger, is also likely to weaken compliance with the mobility restrictions policies. So by now, there are many clear lessons both from the Philippine experience and from emerging international best practices. So in order to mount a more successful economic recovery, the Philippines must address the following key policy issues. So the first one, build a more efficient containment strategy, particularly against the threat of possible new variants, principally by strengthening the test trace track system. Based on lessons from other countries, test trace track system usually also involve comprehensive mass testing strategies to better inform both the public and private sectors on the true state of infection among the population.
In addition, integrated mobility databases, not fragmented city-based ones, also capacitate more effective and timely tracing. So this kind of detailed and timely data allows for government and the private sector to better coordinate on containment strategies that target areas and communities that need help due to the outbreak risk. And in addition to this, unlike a generalized lockdown, this targeted and data-informed strategy could allow other parts of the economy to remain more open than otherwise. Next, we have to strengthen the sufficiency and transparency of direct social protection in order to give immediate relief to poor and low-income households already severely impacted by the mishandling of the pandemic. So this requires a rebalancing of the budget in favor of education, health, and social protection spending, and overemphasis on build infrastructure projects of President Duterte. So this is also an opportunity to enhance the social protection system, to create a safety net and concurrent databases that covers not just the poor but also the vulnerable low and lower middle income population. The chief concern here would be to introduce social protection innovations that prevent middle income Filipinos from sliding into poverty during a pandemic or other crisis. Next, we have to ramp up vaccination to cover at least 70% of the population as soon as possible, and enlist the further support of the private sector and civil society in order to keep improving vaccine rollout. An effective communication campaign needs to be launched to counteract vaccine hesitancy, building on trustworthy institutions like academia, the Catholic Church, civil society, and certain private sector partners in order to be better or to better protect the population against the threat of Delta variant. The threat of Delta variant or another variant affecting the Philippines. So an effective communication campaign needs to be launched to counteract vaccine hesitancy. And in order for us to build trust or trustworthy institutions,
It will also help if parts of the government could stop the politically motivated fear mongering on vaccine, as had occurred with the dengue fever vaccine or the Dengvaxia, which continues to sow doubts and fears among parts of the population in the Philippines. Next, we have to create a build back better strategy anchored on universal and inclusive healthcare. So among other things, such as strategy should acknowledge the critically important role of the private sector and civil society in pandemic response and healthcare sector cooperation, and underpin pandemic response around lasting investments in institutions and technology that enhance contact tracing, just like platforms, testing labs, and universal healthcare with lower out-of-pocket costs and higher inclusivity. So the latter requires a more inclusive, well-funded, and better governed health insurance system. So as much of Asia reels from the spread of Delta variant, it is critical that the Philippines takes these steps to help allay concerns over the country's preparedness to handle new variants emerging, while also recalibrating expectations in favor of its economical impact. So only then can the Philippines avoid becoming the sick man of Asia again and return to the rapid and steady growth of the pre-pandemic decade. Community action planning. So when people around the world started to bear the brunt of the COVID-19 pandemic in mid-2020, the World Bank launched COVID-19 surveys to monitor the social and economic impact of the pandemic on communities. In the Philippines, the community survey conducted in collaboration with the Department of Social Welfare and Development, or the DSWD, and provided important insights on how best to deliver pandemic response and recovery programs aimed at supporting the poorest and the most vulnerable rural communities. Respondents included community volunteers in barangay, villages, officials from some of the poorest communities identified through the country's existing National Community-Driven Development Project. So in August 2020, the first round of community survey had 180 respondents representing 101 barangays. The second round in April 2021 had 200 respondents from 135 barangays across the three main group of islands, Luzon, Visayas, and Mindanao. Using a standard questionnaire developed to capture the community's socio-economic conditions, respondents were asked to share their views on the situation in their communities. So these will reflect to the general observations of community leaders based on their perception and knowledge of their respective communities. Economic impact on communities. So COVID-19 has taken a heavily toll on rural livelihoods. Loss of income and job opportunities were overarching challenges in poor communities in the Philippines. Disaster-prone communities experience more difficulties in coping with COVID-19 restrictions and its severe economic impact. And results show the most pressing problems before and during the COVID-19 were lack of income opportunities and reduction of pay where
pre-existing challenges but had worsened significantly due to the pandemic. During the pandemic, communities reported continued insufficient food supply and health, sanitation, and nutrition issues. So the economic impact of the COVID-19 is particularly worrisome as the surveyed communities are already a subset of the poorest and most vulnerable communities in the Philippines. So in August 2020, job losses were particularly severe. In the construction sector, almost 56%, and public transportation around 52%, while cumulative job losses were seen among informal workers, such as laundry women, hairdresser, and workers in small canteens. And in informal retail like sari-sari stores, street vendors, and markets. So the farming sector also saw significant job losses, reportedly in 70% of communities in formal agriculture and 61% in small-scale farming. So the situation had somewhat improved by the second round of the survey in April 2021. The sector that saw the biggest improvements was retail, where reported incidence of the job losses decreased by 13%. However, construction workers and public transport drivers continued to be most affected by job cuts, 56% and 52% respectively. Social cohesion. 74% of communities did not observe any peace and order problems, such as stiff crime and arguments, and community-level conflict because of COVID-19. However, there was an increase in peace and order problems when the second round of the survey was carried out. This seemed to be mainly caused by loss of employment. So, in addition to this, while the cases of COVID-related discrimination similarly increased, there was no increase in sexual harassment, rape, and domestic violence, according to respondents. However, findings from an independent conflict monitoring system, or the conflict alert covering a smaller area of the Philippines, the Bangsamoro Autonomous Region in Muslim Mindanao, suggests that there may be more vulnerable communities. The conflict alert data, based on police and media reports, reveals a significant increase in gender-based violence during the period of strict COVID lockdown. Next, we have the gender and women's role during the pandemic. Half of the respondents found that women and men were equally affected by job and income losses, while 29% found that women were more affected. Women were also identified as one of the groups most in need of assistance because of COVID-19. Health and vaccine concerns. In the Philippines, access to healthcare during the pandemic remained consistent, though a main challenge was the lack of medical supplies and PPEs, especially in the early phase. The survey finds that there was significant concern about vaccine safety, around 86%, and effectiveness of 60%. Vaccine hesitancy was hampering the rollout of the vaccines in the country. Communities mainly trust doctors and health practitioners for information on vaccines. Though the respondents knew vaccines could prevent COVID-19, they were aware that health and risk mitigation protocols were still needed. While respondents generally found the government-issued rules and restrictions appropriate, they suggested that local government should be
more strengthened and consistent in the enforcement of these health-related protocols. So, in addition to this, vaccine hesitancy continues to be a challenge in the Philippines, and further analysis is being initiated to identify key incentives and constructive messaging. So the result of community survey along with the firm and household surveys were shared with the Philippine government and other stakeholders. Future rounds will strengthen the validity of results and provide an opportunity for focusing on additional sub-themes including gender and coping strategies or new themes that emerge as relevant. The survey clearly highlights how poor and vulnerable rural communities are affected by the economic impact of COVID-19. Going forward, we hope that the valuable insights into the situation and perceptions of the communities can help inform target policies as well as response and recovery programs. So how the Philippines responded to socioeconomic impact during pandemic. So the COVID-19 pandemic brought about many revelations that forced everyone to reassess. Amidst the challenges and difficulties, it showed that a holistic and unified approach trumped a profit-centered individualistic mindset. Rather than just striving to return to normal, we are seeing more countries promising to build back better. In fact, thanks to vaccination, the transition to sustainability, and international aid, the World Bank already predicts a 4% expansion in the global economy this year. It must be noted that this growth will no doubt be fueled by wealthier countries with stable healthcare sectors. Meanwhile, economy recovery in developing countries will be slower, and in 2020, the World Bank predicted that these emerging markets will likely shrink by 2.5%. So, while this might seem trivial on a global scale, an article on how the pandemic has caused a global recession explains that with poverty affecting millions of people, a slight recession will have a long-lasting repercussions on those developing countries. The COVID-19 pandemic has brought about business closures, inflation, and widespread of unemployment. And these effects are all more salient in developing countries like the Philippines. So in response to this, private citizens are coming together to bridge ever-present socio-economic gaps through community aid, particularly in the form of community pantries. Through these community pantries, lower-income families have receive essentials in their time of need. As the Philippines COVID-19 cases begin to increase again, these compassion-driven efforts are helping mitigate the pandemic effect. Community pantries as means for mutual aid. So while the response helped to control the spread of the virus, it soon became apparent that financial and food aid was necessary. As a developing country with 16.7% of the population living below the national poverty line, many Filipinos are daily wage earners who cannot afford to stay home. The government aid being handed out is also not enough to sustain most Filipinos. According to the 2020 Global Hunger Index, the Philippines ranked 69th out of 107 countries. And so on April 14, a small bamboo cart in Maginhawa Street in Quezon City the largest in Metro Manila, began what would be an inspiration for others and a notice to the government. Filled with canned goods, fresh vegetables, vitamins, and other pandemic needs, the Maginhawa Community Pantry soon took social media by storm. So this pantry, created by Ana Patricia Non, serves as approximately 2,000 families a day. This includes seniors and disabled who have not been allowed much movement since the first lockdown. Since its genesis, roughly 350 other community pantries have cropped up in the country. While these mutual aid efforts have been largely lauded, it has not been immune to red tagging. The latter is a colloquial term for the practice of accusing others of communist collaboration. More often, there is little to no evidence of such ties. On April 18, social media showed police with high-powered rifles expecting the Maginhawa Community Pantry. So they are inspecting the Maginhawa Community Pantry. People will not stop giving as long as there is a venue for it. So since then, community pantries in the Philippines have gotten more structured. Recently, actress and activist Angel Locsin celebrated her birthday by renting out a small venue and outfitting it with essentials. Non-profit animal welfare groups have also introduced community pantries for pet owners in need. So as the world begins to reopen, countries like Iceland and New Zealand have become the standard for prompt and mindful pandemic responses, with an emphasis on well-being indicators. In places like the Philippines, people are still waiting for their government to provide aid and sustainable solutions. In the meantime, the fight for sustainable development is being led by everyday Filipinos who are inspiring millions daily.